is NAD+? NAD+ stands for nicotinamide adenine dinucleotide. It is a coenzyme molecule present in every living cell of the body. NAD+ is a key player in the cellular metabolism of the body and is used to produce energy. What does NAD+ do in the body? NAD+ is essential in the mitochondria's role of turning food into ATP molecule, which is the main fuel for all body's functions. ATP is also called energy currency of the body. Thus, NAD is involved pretty much in all parts of physiology, such as metabolism, energy production, maintenance, repair, immune system, hormone balancing, healthy stress response, detox and elimination, sleep cycles, mental health, and much more. Other, no less important functions of NAD+ are regulation of cell survival, involvement in DNA and RNA repair, and also in keeping the brain communication systems working smoothly. Without enough NAD+, the body and brain feel like a car running on a low battery. How is NAD+ produced? NAD+ is produced in two ways. One, like with many other important substances, the body can and does effectively recycle NAD+. Two, new production of NAD+ using niacin, which is vitamin B3, and amino acids, mainly tryptophan and aspartic acid. Important fact to remember: NAD+ is not the same as niacin. Niacin is converted to NAD+ in the body, so NAD+ is the bioactive form of niacin. One of the main roles of niacin is to maintain and make sure there's adequate supplies of NAD+ in the body. What foods increase NAD+, and how to raise its level naturally? Eating a healthy whole food diet with a no or minimum amount of refined food that strip away B vitamins. Recent studies show that resveratrol, the type of polyphenol in plants, greatly increases NAD+ in the body. Resveratrol-rich foods are grapes, peanuts, pistachios, dark chocolate, berries, especially bilberries, blueberries, raspberries, mulberries, red and blackcurrants, and cranberries. Other NAD+ raising healthy habits are exercise, great sleep hygiene, stress management, and intermittent fasting. Although the latest research shows that an abundance of resveratrol-rich foods get similar results to intermittent fasting, but without food restriction. Does NAD+ IV therapy work? Yes. The advantage of NAD+ IV therapy is that it delivers NAD+ directly into the bloodstream, providing immediate availability to the cells. This avoids the entire gastrointestinal system, which can be usually compromised during times of stress or on certain medications. Many people notice great improvements, especially in energy levels, mood, mental clarity, focus, and improved sleep. NAD+ IVs allow for higher and more immediate restoration of NAD+ levels in the body. Can NAD+ help with mental health? Yes. Research suggests it can help to improve mood, reduce anxiety and depression, increase focus and mental clarity, reduce inflammation, repair brain cells, and support brain function by boosting mitochondrial energy. How does NAD+ affect mood or depression? Low NAD+ impairs the brain energy metabolism and neurotransmitter production. Restored NAD+ levels result in mood stabilization and improved emotional resilience. Is NAD+ used in anxiety treatment? Yes, and very successfully. NAD+ results in reduced inflammation, calming overactive stress pathways, and neurotransmitter balancing, especially by optimizing the homeostasis of the glutamic acid system between glutamate and GABA. Does NAD+ support brain function? Yes, by supporting neuron energy and repair, reducing inflammation, protecting against oxidative stress, promoting focus, mental clarity, memory, and learning. Can NAD+ improve focus or cognitive clarity? Absolutely, due to increase in brain energy, reduce cellular stress, reduce inflammation, and protection against oxidative stress. What role does NAD+ play in neurotransmitter function? NAD+ supports neurotransmitter balance, recycle, and repair, keeps brain cells communicating correctly, maintains high mitochondrial energy, reduces inflammation and oxidative stress. NAD+ is an essential coenzyme powering enzymes involved in virtually all neurotransmitter production, such as oxytocin, serotonin, dopamine, epinephrine, norepinephrine, acetylcholine, GABA. These important neurotransmitters regulate mood, motivation, memory, focus, and cognition. What is NAD+ therapy for addiction and withdrawal? NAD+ supports brain during detox by replenishing mitochondrial energy, reducing oxidative stress and inflammation, helping neurotransmitter repair and balance, which results in fewer withdrawal symptoms, reduced cravings, repair damage caused by substance use, promoting neuroplasticity and healthy nerve signaling, faster recovery, and relapse prevention. In other words, you feel better faster. How does NAD+ help with detox symptoms? NAD+ helps with detox symptoms by supporting energy production and smooth brain cell communication. It reduces fatigue, mood swings, irritability, brain fog, and sleep issues, very common during detoxification process. How long is a typical NAD+ detox program? Conventional NAD+ IV treatment lasts anywhere from 3 to 10 days with optional booster sessions. At Alternative to Med Center, we take targeted and individualized approach, timing NAD+ treatments with each client tapering schedule to reduce uncomfortable symptoms, maintain energy and mood, and support restful sleep. Is NAD withdrawal support backed by research? Yes. A growing number of clinical research and case studies support the use of NAD+ for withdrawal symptom relief, brain repair, and mood stabilization. More large-scale clinical trials are needed, but current evidence and clinical experience suggest that NAD+ is a promising and very effective tool. Additional resources are clinicaltrials.com, National Institute of Health database, PubMed, and peer-reviewed journals focusing on addiction and recovery. Are there side effects to NAD+ detox? Side effects to NAD+ therapy are rare and typically very mild. Most common side effect to IV NAD plus therapy is palpitations, which usually go away when the infusion rate is slowed down. Other mild effects could be temporary headaches, nausea, or muscle tension. Most people tolerate IV NAD plus very well, but it is not for individuals with active cancer, history of cancer, severe liver or kidney impairments, or pregnancy and breastfeeding.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.